Vaginal dryness occurs when the vaginal tissues become less lubricated and less elastic, often due to decreased moisture in the mucosal lining. This condition most commonly affects women during periods of hormonal change, particularly during menopause, but it can also occur at other stages of life, including during breastfeeding, after childbirth, or due to certain medications or medical treatments. Vaginal dryness can lead to discomfort not only during sexual intercourse, but also in daily life, causing burning, itching, or irritation. This can significantly impact a woman's quality of life, both physically and emotionally. The primary cause of vaginal dryness is a decrease in estrogen levels. Estrogen is a key hormone that keeps the vaginal tissues healthy, elastic, and moist. Menopause, the postpartum period, breastfeeding, surgical removal of the ovaries, and cancer treatments such as chemotherapy or radiation therapy can all lower estrogen levels. Additionally, hormonal contraceptives, antidepressants, antihistamines, certain blood pressure medications, and systemic diseases such as autoimmune disorders, for example, Sjogren's syndrome, may also contribute. Psychological factors like stress, depression, or anxiety about sexual activity can worsen the condition. Smoking is another contributing factor, as it reduces blood flow to vaginal tissues. If left untreated, vaginal dryness can result in painful intercourse dyspareunia, decreased sexual desire, increased risk of vaginal infections, and more frequent urinary tract infections. Therefore, addressing this condition is important for both physical comfort and sexual well-being. The treatment approach depends on the underlying cause and the woman's stage of life. The first step in treatment is identifying the root cause. For cases related to menopause, local estrogen therapy is highly effective. This can come in the form of creams, suppositories, or vaginal tablets. Local applications are generally preferred over systemic hormone therapy, as they are minimally absorbed into the bloodstream and thus have fewer side effects. These treatments usually restore vaginal elasticity and moisture within a few weeks. Because systemic absorption is minimal, the risks such as endometrial hyperplasia are low, though in some cases, doctors may recommend adding a protective progestin for those who cannot or prefer not to use hormone therapy. Non-hormonal vaginal moisturizers and lubricants can be helpful. Vaginal moisturizers are used regularly, typically every few days, and help maintain natural moisture levels in the vaginal tissue. Lubricants, on the other hand, are applied before sexual activity and provide temporary relief. These products are often available over the counter, but may not treat the underlying cause. Some women opt for natural or plant-based treatments that contain phytoestrogens, such as soy isoflavones or red clover. These plant compounds mimic the effect of estrogen to a degree, and some women report benefits. However, the scientific evidence on their effectiveness is mixed, and they should be used with medical guidance. The duration of treatment and time until noticeable improvement varies based on the chosen method and the individual's condition. With local estrogen therapy, most women experience relief within 2 to 4 weeks. Moisturizers offer more short-term effects and must be used consistently. Full resolution or optimal comfort may take several weeks to months, depending on individual response. Common medications used include estriol or estradiol-based products, for example, Ovastin cream or suppositories, non-hormonal vaginal moisturizers. For example, Replens, Gyneflor, and water-based lubricants for intercourse. Vaginal probiotics may also be recommended, especially in women who suffer from recurrent infections. In addition to medical treatments, strengthening the pelvic floor muscles, staying hydrated, avoiding irritating soaps, quitting smoking, and maintaining regular sexual activity can all support vaginal health. Regular stimulation helps maintain blood flow and tissue elasticity in the area. If you are experiencing symptoms of vaginal dryness, it is best to consult a gynecologist, especially if you are in menopause or taking medications that might be affecting hormone levels. A personalized treatment plan is essential. Ignoring the problem will not make it go away and can negatively affect your quality of life and intimate relationships.